Good day, everybody, and thank you to Sama for the opportunity to present to you on this topic. My brief at this time is to just give you a sense of pandemic telehealth lessons and perhaps how this might be changing the healthcare industry going forward. I mean, it's really clear that we are all going through, and it's perhaps become a little bit of a cliche to say that it's very much an unprecedented time, but there's no doubt that that is the case. And the reason I suppose we keep on repeating that phrase is because of it being true. So as we move hopefully through the pandemic, there will be things that are sustained and changed into the future, and that's what we'll focus on in our discussion through this presentation. So with that, let's kick off. Hopefully what we'll start with is analysing the current environment and what it's looking like at the moment with some of the trends that we are seeing. A very quick look at telehealth trends and what it looked like through the first wave at least. A little bit of a discussion about telehealth and how that keeps us connected. And I'll give you a bit of a case study, and then we can talk through some of the things that are available that help us stay connected in this time. And as per the brief, it's about then looking forward. What does the new future look like as we go forward past the pandemic? So kicking off with an analysis of the current environment, there's no doubt that there's been this, what we'd call utilization discontinuity, that the way people accessed healthcare during the COVID period has been very different to that which we normally experience through the medical scheme claims. What we saw during the first wave, though, is that it wasn't all doom and gloom for everybody. That there were certainly some. We saw reductions in income, and what you'll see here on your left is what it looked like for some GPs who did see a significant reduction in the number of consults that they performed. But on the right, you'll see that in the mental health case, and this happens to be psychology, that quite quickly they were able to recover the mechanism. Much of what they did moved online, and they were able to actually increase the activity and really offer some quite fantastic support for people that were struggling, especially at the outset of the pandemic. Not to say that people don't continue to struggle, but certainly in those first days, if you recall, it was really, really difficult. I think there's different mental health care issues that we face now due to the longevity of the pandemic. But certainly the mental health care professions have stood up and really supported many through this difficult period. There's lots of stories around various disciplines and how they've managed to address some of the challenges of the pandemic. Certainly some GP practices that I've spoken to have had better years than they've ever had. But what's clear is that in order to do that, they had to do things differently. Certainly the sacrifice of looking after patients with COVID, but also changes to their practices to accommodate for this very unusual and different environment is what's been the hallmark of their success. There's other places then in the industry that have also been forced to change and adapt to the environment. So one example is that there's been a significant increase of, for example, GI scopes that have been done out of the acute hospital environment and now done either in endoscopy suites or in day case facilities. So the picture on the left shows you the significant decline in activity for the in-hospital environment and more in these alternative settings of care. Of course, this is in many instances driven by doctors not being able to access acute hospital facilities because they were full of COVID patients. But our sense is that while this was a trend pre-COVID, that doctors will continue to use these facilities now that they've built a relationship and have confirmed and are now satisfied that those types of investigations can be done safely in that particular setting. You'll see then on the right, similarly, as a result of COVID, there was a trend to use daycare facilities more frequently over time. And what you'll see is that there's been a 15% growth in the number of cases, and in terms of spend, a 24% year-on-year increase since 2009 in the use of daycare facilities. So our sense is that due to daycare facility convenience and the fact similar to what happened in gyroscopes, that because of the relationships formed with those types of facilities, that it's very likely that that as a trend will continue. It's not all an easy ride, though. If you look at research, and this is a study done by Stanford Medical School, and what you'll see is that many doctors still feel somewhat uncertain about this shift into these new types of care interventions. There is, however, and I see this in my interaction with the profession, that a third of doctors recognize that a lot of what they're going to do, or not so much a third of job, but a third of the activity of the profession in the next 20 years will move into some automated activity. And doctors need to prepare for that. And the question positively is, what then would doctors do with the time and efficiency that are unlocked through automation? And I'd imagine that that's a challenge that one has to consider. What doctors are saying, though, is that they don't necessarily feel that their training has adequately equipped them for this type of shift in activity, as has happened in other industries around the world. So you'll see that 47% of physicians, 73% of medical students are saying that they need additional training in this new way to deliver healthcare, and that there are significant gaps, especially in telemedicine, personalized medicine, and genetic medicine, that they feel that they need to get to grips with, and that should be incorporated into training so that they can also embrace this new future in a positive way. You'll see that the study goes on to say 18% of medical students and almost half of physicians are saying that their education isn't really that helpful in learning about how to use these new technologies in their day-to-day practice. That is not dissimilar, I'd imagine, from other industries where if you listen to the fact that most industries, most professions are saying that what they learned in their university days has changed so fast and so often that it is more self-learning and finding other mechanisms to access learning that are as, or in some cases, even more important than what they learned at university. What are potentially the areas to focus on? And if you look at some of the international care delivery systems, in this case, the US, certainly on-demand virtual care is becoming a trend. Rather than going to emergency rooms, you're seeing these urgent care facilities being something that becomes more common. These things and these facilities do exist in the South African context, where there are the beginnings of this type of movement, where you can get urgent care, not necessarily emergency care, in certain units around the country. If you look at the American environment, they're expecting that that's going to create a significant saving to their healthcare system, because those units typically are often more financially cost effective, with similar, in some cases, for some patients, even better quality of care than happened before. Virtual office visits, a trend following on from COVID, is definitely going to be a future trend. Certainly primary care, mental health care, psychotherapy, and selected other specialty follow-up care are opportunities. Not everything. I mean, it's absolutely clear that there's no way that you can do all medicine virtually. Medicine requires often in-person, touching the patient to be able to perhaps do diagnosis and understand what treatment plan to prescribe. But certainly there is this trend of, in its time and place, that virtual care is going to become an increasingly common part of the healthcare and care delivery landscape. Near virtual care, so combining virtual care with different types of technologies, elements of home testing, elements of investigations, is again going to become, and increasingly so as technology advances, a feature of our environment. Point of care testing is becoming an increasing feature of healthcare systems around the world. So that's definitely going to be features of what we see. Remote monitoring and digital patient engagement, which we'll talk to a little bit later, certainly was a major feature even in our environment over COVID, and that's going to become a forward trend. And then tech-enabled home medication administration. So certainly there's a trend in South Africa towards infusion centers. Many doctors around the country have got infusion centers linked to their practices, family doctors, specialists. I was recently in a neurologist practice who's got an infusion center for appropriate neurological conditions, and they're offering that directly to patients in a very convenient setting. So that's going to become more prevalent, and now home delivery of these types of therapeutic advances, where with the support of a home nurse, people can now increasingly have these types of interventions in their own home. Where you pull these interventions together, there is a significant financial saving at what is at least the same, but as I've mentioned before, in some cases even enhanced outcomes, and that really is the true testament to value. Let's move forward then to telehealth trends, and to give you a sense of how that worked. And this is a view of virtual consultations per day, and the picture on the bottom shows you the first and the second COVID waves, and you'll see that it's absolutely mirrored by virtual consults happening in line with those trends. So at that time, clearly there were patients who were trying to avoid in-person care for fear of being exposed to the virus, and in doing so, they sought accessing and staying connected with their doctor via virtual approaches. So certainly these trends existed then, and there's absolutely no doubt that this will be a trend, as is happening around the world, going forward. In talking to doctors, many of them have said, certainly in the early phases of the pandemic, that there was this issue about trying to stay connected to patients, that in some instances virtual care was a hindrance to that. There is, of course, then the argument, which I'll present now, that says that it is these virtual engagements that actually helped people stay connected rather than were a hindrance to that type of interaction. So one example would be patients who have got a chronic illness, and similarly, we definitely have seen a trend of patients over the pandemic having chronic illnesses, specifically being afraid that because they may be to a degree have some elements of immunocompromise. So those patients definitely in the beginnings of the pandemic and through the pandemic have not attended to their chronic health needs as they should, and there certainly is a fear that could result in poor clinical outcomes. So there is this opportunity now where using virtual platforms, as was happening during the pandemic, that patients could now access more care through these virtual consultations supported by other telemedicine tools. And you'll see that New England Journal of Medicine did suggest this as an opportunity to help more people access more care more often in a more convenient way. So what Discovery Health supported patients to do during the pandemic was a proactively funded virtual consultation where we asked doctors who obviously had great relationships with patients that were under their care with chronic illnesses, rather than not wait for the patient to reach out to the doctor, we asked the doctor to reach out to the patient. So what this essentially did was mimic that old style doctor house call, which is obviously less frequently available today in the current and modern medical healthcare system. But that virtual house call could now be done virtually. And you'll see on the right that there's these other support tools that we can offer to doctors, obviously under member consent through our various data collection portals and so on, where the doctor can engage with the patient, have a sense of their history, capture that particular engagement, and really keep the patient involved. So the process really was identifying patients who are at risk, okay, with predictive analytics and advanced algorithms to say, these are the patients that were at risk of serious illness. See the allocation, so we could identify also through AI algorithms the relationships between those patients and their doctors, alert those doctors then to the fact that we've got this benefit, and with appropriate consents, prompt the doctor to trigger an interaction with that particular patient with a digital checklist to say, these are the things that hopefully should be covered. At least those. I mean, clearly doctors know how to engage with patients around these types of interventions, but hopefully be in a supportive way. It's support the consultation with technological advancements, and hopefully turn the tide on those particular patients' risks of potential exacerbation of their chronic illness or the need for hospitalization as the pandemic started to abate. In doing that, and not necessarily part of virtual house calls, but there is a number of devices that certainly support these types of interactions where, like never before, the doctor can have insight where they've got permission to do so from their patient. Of course, all of this is under consent, and in that very close doctor-patient relationship, there are opportunities to gather clinical information and potentially make better clinical decisions with some of these metrics available. So you'll see there on the left a spirometry device. There's two different options there that are provided. And during the COVID pandemic, I had the opportunity to engage with a pediatric pulmonologist that was using a device like this to stay in touch with the doctor's cohort of cystic fibrosis patients. So really the doctor didn't want those patients necessarily, unless it was absolutely necessary, to attend visits in the hospital for fear of exposure to the virus. But the doctor was able to keep track of those patients virtually. These are patients, obviously, that the doctor's known well for many, many years. As you know, cystic fibrosis is certainly a long-term illness, and the doctors have got very long-term relationships with these patients in the pediatric space. This is certainly not limited to pediatrics. It could be appropriate for all ages, dependent on the particular conditions, but it was an excellent opportunity for the patient to stay connected with their doctor. On the right there, you'll see a number of options for continuous glucose monitoring. So certainly another chronic illness where technological advancement has happened very, very quickly. And there's the ability for the doctor to not only check on the patient at the time that they come see the patient. If you talk to diabetologists, they'll tell you that control is excellent just before a doctor visit. What happens thereafter, though, not as good. But with continuous glucose monitoring, the doctors are able to identify and see what's happening to glucose control between visits. Also, what happens at night, which is often something that is quite difficult where the patient can't necessarily report on their symptoms. So continuous glucose monitoring really has been a game changer in diabetic control. That linked to automatic dosing, linked to the findings of the automatic glucometers, has really been very helpful to patients who suffer from diabetes. So these are ways where the doctor can then get these metrics online, perhaps consult with a patient where possible. Clearly, where it's not possible and it's not optimal, the patient should obviously go in and see the doctor. But there are these mechanisms to stay connected using these technologies, and those are two what I think are very good examples of where virtual care may start to become ever more present in the environment. There's absolutely no doubt that one has to move carefully into these new realms, that the idea and the concept of pivoting plays out here. And when you start to talk about pivoting, the idea is that you plant one element of your foot, for example, in the case of this basketball analogy, in one place, and then you turn to find a different approach to how you'd go about solving a particular problem. So the trick here is to really pivot wisely, that it's not about pivoting too quickly or pivoting away from tried and trusted medical advice. This holiday of almost legacy learning. We must not, legacy learning is not bad learning. Legacy learning is great learning. And the reason why it's repeated is because that helps patients. But now there are these opportunities to enhance that learning. And the idea is to pivot slowly and pick those new learnings that will enhance care to patients over time. So this idea of embrace the trends that energize the pandemic, but do so in a way that's appropriate and responsible. And I think that that is certainly a core principle that needs to be applied now and going forward. Moving into the new future, what is it and what might that new future look like? And how do we potentially look at what that new future may hold for all of us? Perhaps one way to look at it is under headings. And if you look at the trends that are noted globally in terms of healthcare challenges, some of them have been discerned or identified as the following. One is that there's a big shift to more demanding consumers who are better educated and really look to value. They look to the outcome of the care that's offered to them, being that this is now measurable in many cases. That there's, of course, an increasing burden of disease with COVID, but pre-COVID and post-COVID, there's definitely going to be this ongoing trend of diseases of lifestyle being a major feature and focus of the care that's offered patients. We've seen some of the data that's come out regarding COVID being a trigger for diabetes, but also other chronic healthcare conditions. So if anything, disease burden is going to increase, and the role of the doctor is going to be ever more important with ever more patients to care for over time. Around the world, there is this global challenge around healthcare consumption. We'll talk a little bit about that, including waste, meaning we've got to get patients to the right place at the right time to the right person, rather than floating around the healthcare system, trying to find an answer to their care. And there's ways to potentially do that. Compliance is going to be an ongoing issue. We need to make sure that people are kept safe. So be it clinical compliance with best practice, funder compliance with regulatory responsibilities, information compliance, especially in this world where a lot of information now is sitting in more public spaces, that there needs to be issues of compliance and consent, and we'll talk a little bit about that. And of course then, this move to more innovative treatments, we've spoken a little bit about them, and we'll speak perhaps a little bit more about them as we move into this new future. So in terms of discerning consumers, there's no doubt that this isn't something that is a push into the environment, but what you're finding increasingly is that these digital solutions is what people want to use. If one example on your right there is the uptake of wearable devices. I certainly wear one, I'd imagine many of you do too, in terms of tracking your steps, and increasingly not just steps but other metrics, heart rate. You'll know that many of the new devices, well, not yet freely available in South Africa, monitor cardiac rhythms and so on. So these are devices that are easily available before you get into those more sophisticated devices that are particularly clinical grade, like continuous glucose monitoring, spirometry, and other devices that are beneficial to people's health. So increasingly, you're going to find that patients are going to gravitate to where they're going to get those types of solutions, where they feel supported and monitored in a way that helps them manage their healthcare. The other point, if you look at the slide on the left, is that increasingly it's not just about the young and digitally engaged millennials. It's certainly all age groups are growing into the space where I can say my late grandmother, who unfortunately passed away in her 90s, in her mid-90s, but she was a whiz on Skype and could certainly engage in virtual consultations and would certainly keep connected with the family, although being, debilitated towards the end of her days, but was able to keep connected using digital means. And that no doubt will be something that's increasingly accessible to even the elderly population going forward. So talking then to increasing disease burden and the size of these problems. If you move around that ring that I presented to you. So Discovery Health Medical Scheme spent almost 7 billion rand, or spends almost 7 billion rand per annum now on chronic illness. The bulk of that, by the way, is in hospital care. The minority of it is out of hospital care. But what's clear, though, is it's growing. It's growing year on year. If you look there, 2010 to 2019, you can start to see how this epidemic of chronic diseases of lifestyle is putting a drain on the healthcare system. But from a clinician's perspective, clearly those people suffering severe morbidity and certainly increasing mortality as a result of their, the presence of this chronic illness. So members with diabetes, for example, have a 6% higher hospitalization, their length of stay are longer, 9% higher cost per event in hospital. Wouldn't it be exciting if we could start to shift some of that activity out of the hospital by keeping people well, by rather dealing with these, these chronic exacerbations of care and the need to look after those patients almost towards the end of life? That could we turn the tables and move using these new technologies into a place where we really keep people well, which is for us a shared value message, where if we could keep people well, it unlocks more value in the system. That value could be used, as I'll demonstrate now, to support family practitioners primarily, but also specialists as necessary, to look after these patients as they really want to. And obviously from the patient perspective, staying well is the primary objective. No patient really wants to go to hospital or get ill. So that would be a win for the patient, and certainly for the medical scheme, it enhances sustainability, because if the majority of costs are going into hospital level care, if we could do more out of hospital care, keep people well, spend more money there and avoid those hospital costs, it would add to the sustainability of the medical scheme. So how is it that we could potentially achieve this virtuous circle? Well, it isn't science fiction. Disease management programs do achieve this, and I'll show you some discovery data on this in a moment. But if we could enhance care coordination and improve those relationships with patients, get more adherence and patient compliance to evidence-based pathways, and encourage patients to modify bad habits and lifestyle behaviors, we can absolutely turn the tide on these issues. Things like diet, exercise, appropriate foot care, eye care, all these issues definitely make a significant difference to achieving that shared value ideal that I've mentioned. How could we do it? Well, one is Discovery's got diabetes care programs. I know many of our competitors now also offer these types of programs, and that's to everybody's benefit. How does it work? Well, the members encouraged to join the program, they access their doctor. What it does is, once they've signed up for the program and commit to doing certain things, they get certain additional benefits and support. We get now in this digital world the ability to track their progress under their consent, And obviously those that do better get better incentives and are supported and are encouraged to do better and continue to do better through those incentives. And certainly there's the opportunity for self-management supported by things like health coaches and those types of mechanisms to keep them engaged and supportive, in support of the doctor. So you've got the doctor supporting the patient, giving them advice, setting care pathways, the funders creating more benefits so that the patients can access those care pathways and support the practices to do more of that type of care, and then incentives for those patients to stay engaged. For the doctor, there are specific incentives, the ability to track programs through digital means, monitor patients' disease projections and effects, and get additional support. In this particular program, Discovery pays for a long consult once a year for those patients, and also a monthly management fee, so that it compensates the doctor to spend time monitoring and looking out for those patients in times where they're not necessarily seeing them in the practice. Clearly, if you see a patient going out of range, there's the ability to call them in and see those patients and encourage them, or the health coaches could do the same in support of the doctor, encourage the patient to see the doctor if they're worried about something, and that's how that program runs. This program's been running for a number of years now, and I'm really positive to report that it is showing positive impacts. You see an increase in the number of visits to family doctors. You see better HbA1c results, more lipograms being done, so better tracking. And we've seen a 6% drop in hospital admissions, showing the value of how disease management programs support and improve the well-being of patients in the various disease management categories. Talking to the consumption of healthcare, I spoke earlier about this need to try and get enhanced coordination of care amongst the healthcare system. You'll see that this is an example of a patient, again, diabetic example, maybe with some vascular disease. That patient could enter this healthcare system anywhere in the system. They could enter at the family doctor, and some patients have got more than one. They could go directly to the specialist. There's certainly examples of patients going directly to the surgeon as their first point of care, and the surgeon then referring the patient back down the chain to the family doctor, or in some cases to the specialist, to do appropriate workups before they understood whether or not they needed surgical intervention. So this fragmentation around the system and the complexity of the system to a patient who doesn't necessarily understand what an appropriate care pathway should look like can definitely cause a problem and waste both time, money, and certainly if there's a situation where the patient isn't getting the right intervention, that could result in complications that could be avoided. Some of these situations, of course, happen over months to years. So sometimes the first time you see the patient is at the end of the chain in hospital, where in some cases, if they had the appropriate screenings and so on by the family doctor, you could have avoided those types of scenarios. There are literally hundreds of thousands of people who are pre-diabetic and diabetic that need the support of family doctors and other medical specialists and professionals that could avoid that end procedure. And I think the challenge then is identifying those patients and getting them as soon as is necessary into those disease management programs to manage these types of scenarios. Of course, it is now with these types of electronic devices, measurement and monitoring, point of care testing, those types of scenarios that will help us identify these patients sooner and intervene more appropriately. Of course, I mentioned that compliance increasingly is a worldwide trend, as I mentioned in the circle. And of course, everybody now needs to pay attention. Of course, with the Protection of Private Information Act, there's actions that need to be taken to guard personal information and take this very seriously as these digital tools become more ubiquitous. Examples of how we do that in the discovery space is, in our connected care app. It's very much password protected. There's various types of authentication and confirmations of who's able to do certain tasks. Certainly, for example, a practice manager would have the ability to see claims and claims-related issues, not clinical issues. The clinical doctor, under consent from the patient, would potentially, with consent, have access to that type of information. So through Health ID, that's where a lot of the discovery clinical information, or the portal that's used to share this type of data with the profession, that would be the mechanism. And certainly there are many checks and balances in place with secure logins and so on. Similarly, when we start to get into the environment of virtual consultations, we've been on record to say that medical grade virtual consultations is what's required. And we need to make sure that we're doing these things on secure platforms, and where clinical information is shared, it needs to be in such a way that it can't be hacked, or that information can't be intercepted for any nefarious purpose. So a lot of focus will, especially with POPI, be placed on making sure that compliance is maintained, to make sure that we get the optimal value out of the new digital environment. When we talk to innovative treatments, I showed you earlier certain ways to monitor patients. Here's some additional examples. These are available today in the South African environment. There's versions of the BIOBEAT device. That's one example where a patient, and this happened under COVID, where especially there was a pressure and a crush in beds, where patients who needed at least general ward admission, sometimes oxygenation or more careful monitoring, couldn't get access to hospitals that were full. So the option to admit patients into our home program then exists. And here's an example of a device that you would just stick onto the patient's chest, would easily monitor that list of list of physiological metrics that were available, then to the treating doctor, supported by other supporting healthcare services, be they nurses or monitoring central call centers and so on, so that the doctor could be alerted if there was a particular problem with that patient. And clearly, even in the COVID space, if somebody was deteriorating, there'd be that urgent need then to get that patient to hospital. What we found with these types of devices is, because of the artificial intelligence that supports the collection of these types of metrics, you can often identify that a patient was actually deteriorating before they actually reported feeling less well. So that's the benefit of these types of devices, data collection supported by artificial intelligence that helps you to intervene sooner. The device on the right is also something that's available today, where the patient not only can do a virtual consultation, but increasingly you can do virtual examination with your consultation. And I think that's a very exciting development in virtual consultations. In this case, you've got an otoscope, stethoscope, tongue depressor, so you can look in the throat, the ears, you can listen to heart sounds, breath sounds, abdominal sounds as necessary, and you can then consult virtually. We've certainly engaged with doctors in other healthcare systems around the world who do this now routinely. There's also a camera, so you can physically look at the patient. You could look at skin lesions and so on as an example. And what you can do is now, as long as you've got that relationship with the patient and you increasingly build it, that you can do these things now as a matter of course within the doctor-patient relationship. So we are now moving to a new future, and we've spoken a little bit about pivoting, and that there is different levels of adoption amongst the medical profession. But I think it's going to be hard for the medical profession to ignore that the world is changing. And it's not because a funder like Discovery is saying so. I think we just got to look around us to see what's happening. So here's an example of the Vatican City in 2005, quite a traditional view with thousands of people standing in the square. if you went there today, this is how it would look. Similar to what you see now at concerts of any short shape or description, people have got these computers in their pocket that can now do a whole range of different things, and it's impossible to ignore that that the world has changed and that these things now exist. There's, of course, in the doctor space, the yesterday view is that manila folder that many still use. The current view, and we've deliberately chosen a device with a pen. You don't have to type, you can write. And by the way, you can even now talk to your computer, and it's increasingly accurate that you could just talk to your computer and that will keep your notes. There's ways to do this in such a way that you can draw the patient in to working with you on patient records, and there's a lot being written about that, about how do you maintain the relationship as you keep track of consultations and so on within this digital environment as well. That is both supportive and inclusive as you move into this new future. There is nothing permanent. I mean, I don't like to shop. I find shopping takes quite a lot of time, but there are increasingly different ways to shop. Many of you probably shop online now and don't necessarily stand in the queues. You can get things delivered. But even if you choose to touch and feel your devices, or not your devices, your products, here's an example of an Amazon store. This is a store that exists where you literally just go shop. You just take the products you wish to purchase off the shelf, and you literally walk through. There's no till. You literally just walk through those devices. All those products are tagged, and immediately that will tally up what it is you owe the store, and it would immediately then just come off your credit card or bank account, dependent on the details that you've provided to the Amazon website. So a completely different way to shop, but turns shopping on its head, saves lots of time, and if you don't want to shop online, you still want the benefit of touching and feeling and seeing the products that you're going to buy, you can at least eliminate that quite boring step of standing in the checkout line to pay for your groceries. So everything's changing. If you look then at healthcare, a number of features, things like 24/7 oversight of a patient in the home, be it for diabetes or increasingly now has happened under COVID for even more acute conditions, that you've got all this information at your fingertips and lots of physician support or GP, physician, specialists, family doctor, allied therapeutic group support for information. The ability to have information, medicine, for example, delivered, okay, with live tracking, so you don't ever, as happened again under COVID, you didn't actually have to go into the pharmacy, you could order it, and if you felt that you were at risk of infecting other people, you could have that medicine delivered. Support for physical and virtual consultations, okay, in different ways, and integrated care management in different ways also is available to you through a host of new devices. I showed you some that are available. These are devices that were product winners in the Consumer Electronics Show, which happens every year. I find it quite interesting. It typically happens in early January, just after the New Year period. It was virtual this year. That typically it's a trade show that is typically in person, that spans many exhibition stalls normally, and I'm no doubt post-pandemic that will return. But they, in this instance, spoke about various sensors that could run for days on end, very lightweight, and a step up from the type of device that you've now got in your watch. So when you start to put all this together, that the COVID pandemic has forced changes, many changes. The trends going forward have been highlighted, and this is information and ideas that come from the World Health, not the World Health, but the World Economic Forum, where there is the sense that virtual is increasingly going to be the new in-person, and that's not an impersonal relationship. If anything, it can support a very emotional, connected relationship with clients, colleagues, patients, educators, doctors, and it's going to be a trend going forward. That artificial intelligence is going to, and has really come into its own already. And I showed you how it was used in the discovery stable around the virtual house calls, where we could link people together that already had a relationship, and make sure that that we were able to support that with different benefits. But there's no doubt that those trends are going to continue. It's certainly not going to be about institutions or countries, for that matter. It's going to be about individuals. I mean, now more than ever, we've seen that a country focusing only on the country's interests in a pandemic state where viruses easily cross borders is potentially at risk, even if they've looked after their own interests. There's no doubt that we live in a shared economy where the good of all is going to trump potentially the good of the individual, and that is definitely going to be a trend that comes, and a learning potentially that comes out of COVID, that we all really have to work together, and that these advancements in learning is going to speed that up, no doubt. As a final point, privacy, we spoke a little bit earlier about the Protection of Private Information Act. That's one example of how privacy will continue to be prioritized. It's not going to be a secondary consideration. All measures will be taken to guard personal information, and you've seen that as a South African trend, and it's certainly a global trend, and no doubt that those levels of security will continue to be enhanced as we move forward. So I thank you for the opportunity to present to you as part of this program, and hopefully some of these ideas and thoughts and some of the data presented will give you a sense of what are the lessons from telehealth learned in the pandemic, and how the South African healthcare system might look going forward. I mean, clearly it's going to be different, and maybe this gives you a window into what that difference might look like. So thank you for your time, and thank you again for opportunities, and understand we'll be able to take a few questions that might be helpful to take this debate a little further. So thank you very much.